Hi, we are here to discuss the results of Carly's evaluation. Carly is a 10-year-old female. She is an only child and lives with her mother and grandmother, who both describe her as an affectionate and generally happy child. She has a diagnosis of a heart condition called Shone's complex and has also been diagnosed with autism by an agency outside of the school system. Carly was taken to Arkansas Children's Hospital just hours after birth, where she underwent open heart surgery and remained in the hospital for 4 months. Carly has since undergone another heart surgery to correct her aorta. Carly continues to have health issues, including pulmonary hypertension. She also takes antibiotics for bladder reflux and medication for hypothyroidism. Carly has adequate hearing and vision, but does have strabismus, or what we know as crossed eyes. Carly's mother reports that all developmental milestones were delayed, and she began receiving speech, occupational, and physical therapy, as well as specialized instruction through First Steps Early Intervention Services. She was transitioned into the school system at age 3 and continued receiving the same services. Carly is now in the 5th grade at Central Elementary School. Her needs are best met with one-on-one and small group instruction, and she participates in the self-contained classroom setting for academic, functional, and social skills instruction with 9 other students with special needs. She receives speech, occupational, and ABA therapy services in order to address communication, sensory, and behavioral needs. Carly participates in lunch, recess, and activity with her same-age peers with the support of her teacher and paraprofessionals. Carly was administered a developmental evaluation through the school system prior to her entry into the special education preschool program. As part of the developmental assessment, the Early Learning Accomplishment Profile was administered to assess the developmental areas of personal, social, adaptive, gross motor, fine motor, communication, and cognitive skills. This is a standardized instrument used to assess children between birth and 36 months. This is used to get a better understanding of a child's skill development and is reported in age equivalence, or how a child of that age would perform. Carly's age at the time of the evaluation was 35 months. Gross motor assesses the development of large muscle systems used for skills such as walking and running. Carly earned an age equivalent of 12 months in this area. Fine motor assesses the development of a child's fine muscle control and coordination, particularly the small muscles in the arms and hands used to pick up items and trace letters. Carly earned an age equivalent of 10 months in this area. The cognitive area assesses skills and abilities that are thought of as mental or intellectual skills. Carly earned an age equivalent of 8 months in this area. The language area assesses skills that would refer to one's ability to be able to use and understand sounds, words, and gestures to communicate. This includes responding to questions, associating words with meanings, and using words and gestures to relate information. Carly earned an age equivalent of 5 months in this area. Self-help refers to the ability to perform tasks associated with daily routines, such as eating, dressing, and toileting, as well as personal responsibilities such as putting toys away and going to bed without assistance. In this area, Carly earned an age equivalent of 12 months. The social emotional area assesses abilities and characteristics that allow a child to engage in meaningful interactions with adults and peers and develop a sense of self-concept and social role. This includes sharing toys and playing cooperatively with others and expressing emotions. Carly earned an age equivalent of 4 months in this area. According to the results of this assessment instrument, significant delays were noted in all areas of development. The Battelle Developmental Inventory 2nd Edition, or BDI-2, was also administered. The BDI-2 is a standardized instrument used to determine functioning of children ages birth to 7 years in the areas of adaptive, personal social, communication, motor, and cognition. The descriptions of these domains or subtests are the same as those described on the previous test. On the BDI-2, the adaptive domain includes self-care and personal responsibility. Carly earned an adaptive quotient of 61. On the BDI-2, scores between 90 and 110 are within the average range. Therefore, she falls well below the average range in adaptive skills. In the area of self-care, Carly's skills are similar to a child that is 11 months old, and she scored the same or better than less than 1% of the population of students tested. In the area of personal responsibility, Carly's skills are similar to a child that is less than 24 months old, and Carly scored the same or better than 1% of the population tested. The personal social domain includes adult interaction, peer interaction, and self-concept and social role. Carly earned a personal social quotient of 55, which falls below the average range of functioning. In the area of adult interaction, Carly's skills were similar to a child who is 8 months old. In the area of peer interaction, Carly's skills were similar to a child who is less than 24 months old. In the area of self-concept and social role, Carly's skills were similar to a child who is 4 months old. According to these scores, Carly scored the same or better than less than 1% of the population of students tested in each area of personal social development. The communication domain includes receptive and expressive communication, and Carly earned a communication quotient of 55, which falls below the average range. In the areas of both receptive and expressive communication, Carly's skills were similar to a child who is 5 months old. According to these scores, Carly scored the same or better than less than 1% of the populations of students tested in each area of communication. The fine motor domain includes gross motor, fine motor, and perceptual motor. Carly earned a motor quotient of 57, which falls below the average range of functioning. In the area of gross motor, Carly's skills were similar to a child who is 11 months old. In the area of fine motor, Carly's skills were similar to a child who is 12 months old. In the area of perceptual motor, Carly's skills were similar to a child who is less than 24 months old. According to these scores, Carly earned the same or better as less than 1% of the population of students tested in each area of motor development. The cognitive domain includes attention and memory, reasoning and academic skills, and perception and concepts. Carly earned a cognitive quotient of 60. In the area of attention and memory, Carly's skills were similar to that of a child who is 19 months old. This score indicates that Carly performed the same or better than 2% of the population of students tested. In the area of reasoning and academic skills, Carly's skills were similar to a child who is 24 months old. In the area of perception and concept, Carly's skills were similar to a child who is 7 months old. Scores in reasoning and academic skills and perception and concepts means Carly scored in the same or better than less than 1% of the population of students tested. According to the results of the BDI, Carly showed strengths in the areas of adaptive skills and weaknesses in personal, social, and communication skills. An occupational therapy evaluation was also conducted. The sensory profile caregiver questionnaire was completed by Carly's mother and used to determine whether aspects of sensory processing might contribute to Carly's challenges. The sensory profile is designed for children from birth to 14 years 11 months and measures a child's response to sensory events throughout daily life. Based on the results of the occupational therapy evaluation, Carly demonstrated deficits in her ability to process sensory information. Difficulty with sensory systems means that the form of sensory input is confusing, upsetting, or not meaningful to the child, which can interfere with her ability to complete important activities successfully as other children do. According to the results of this evaluation, Carly had significant delays in all developmental areas, including adaptive skills, personal social skills, motor skills, language and communication skills, and cognitive skills. Carly showed strengths in gross motor and weaknesses in areas of personal social and language and communication. However, all of the areas of development are in the significantly delayed range of functioning. Carly's strengths include being able to stand alone and move around on hands and knees. She can remove the lid of a box to find a toy and hit a cup with a spoon. Carly can repeat an action that produces noise and hold one cup and take another. She can turn her head to the sound of a rattle and laugh out loud in social play. Carly can overcome simple obstacles, pull off her socks, and chew food well. She is able to express protest and look at the face and eyes of the person talking to her. Carly is unable to walk alone without falling or throw a ball. She cannot hold a crayon and make marks or build a tower of 2 or 3 cubes. She cannot imitate sounds or respond to her name. Carly is unable to combine syllables or imitate playful sounds. She has difficulty vocalizing and gesturing to indicate wants, holding a cup, and showing awareness of wet or soiled pants. She cannot discriminate strangers or respond to verbal requests. Needs in these areas mean that Carly will need assistance mastering basic academic and functional skills, support and assistance building and maintaining relationships with peers and adults, assistance with both gross and fine motor activities, and assistance taking care of all of her personal needs, including dressing and toileting. In addition, Carly's sensory needs will impact most aspects of daily life. According to these results, Carly meets criteria for other health impairment for her diagnosis of Shone's complex and is eligible to receive special education and related services to meet her academic and functional needs. These assessment results are important in identifying Carly's strengths and needs in order to make appropriate educational decisions for Carly.